Good evening, team. My voice is audible to everyone?
Yes,
My
sir.
voice?
Yes, Prabhu.
Yes, sir.
Okay, fine. So I hope everyone are joined in the group, right? In the group, I mentioned that application access details and all everything. So could you please check there your application access, whether it is working or not, and if people can able to install or not. Before going to start, I will be giving you application access for everyone right now. Please check whether you people can able to see the application link in the group or not. Once again, I will be sharing the WhatsApp group link. So you can join there. In the group, I can able to, I posted just now, I posted that like application access details, how to install and what are all the things you need to do, everything I posted there. So just you can check there, please. And later you can enroll and you can click the batch option. Even though you are unable to see that, please let me know and I will check and I will get back to you. Okay, so I posted the group link. So just you can join there and you can able to see that application access. I posted there. Just you can check it.
I am coder.
Yes. Yes, that is application. Please install that application. Okay. So before going to start the classes, I will give you the complete application details to you. And yesterday class recordings also I shared in your groups. So if you missed that, you can able to see the recording sessions as well.
Can you check the recording section?
What ma? Yes, please.
Recording section, so I couldn't maybe.
From yesterday and day before yesterday, the recording sessions are already uploaded into the applications, and as well as I shared the YouTube links as well. So if you missed, you can check there also. Once again, I will be sharing the recording sessions videos links here also in the chat box. So please copy it.
Yeah.
Okay. So I shared that. You can able to see in chat box, and that application details also I shared in the group itself. So you can able to see in the group and you can able to confirm that whether it is like how it is like that and all everything. Before going to enter into that, I can able to sort it over all the application access issues and later I can go there. Okay. Everyone install that application. I am not able to see that. Okay. So could you please mention, already you mentioned your mobile number.
Sir,
Okay,
me also. I am not getting any emails.
Tell me your mobile number, ma. Tell me your mobile number.
9647
9647.
84
Just a 6. 964784.
31.
Harshad, this one,
Yes, sir.
Okay, so refresh and try ma right now. Just a second, stay online.
Sir, I'm also not. Hello?
Just a second, I'm checking that issue. I'm checking that. Just a second.
Sir, Sanidha पाठव Hello. Sir, what is the batch code?
There is no batch code required. If you are installed that your application, just you can mention your mobile number and I can able to check it manually whether it is installed or not. Okay. No more. Sudhakar, just you can join the WhatsApp group and there that application details are there. So kindly install the application and after that you people can able to get the application access. Okay. So first you should install the application access. At the time only I can able to give an access to you.
Okay, sir.
Just a second. Once again, I'll be posting that in the access details and all everything. Okay, so I posted there. So no issues. Almost around 10 minutes are completed. So we'll start the classes and later we can able to discuss about this application access and all everything. Even though if you didn't receive the application access, I will be sharing my number 90434 64563. So in that number, you can mention your mobile number, name, format, and need application access. Like that, you people can send me the text message and I can able to make it that whether you people can able to sharing that. In this format, you can able to share need application access. Okay, so to this number. Okay, so to that number, you can able to share it with me and I will be individually, I can able to given the application access after the session also. When I completed the session, I can able to work on this kind of applications. Is it clear? Give accept now. It is showing accept, no issues because sometime live classes will be done by this application also. So you can give accept. Okay, fine. It's clear. Okay, so shall we start our today's session? Okay, so before going to start the sessions, is there any doubts or any questions you people need to be asked from my end? And anything else is there to discuss with me to get an clarity or something else? Anything else is there? Anything you people need to be asked or any questions or anything else is there? Oh, yes. No. Any doubts or any questions? Any doubts or any questions you people have?
Sir, any hard copy study material given?
Actually, for Ipdrg, you don't require hard copies, no? For CCS only you required hard copies. CCS only you required hard copies. For Ipdrg, we will be sharing you the Ipdrg study guide, which is include like all the things and all everything, all the interview questions and materials and all everything will be there. So there we will be giving you the Ipdrg study guide free of cost. Okay, so including in this batch. If you want the physical copies, I will give you one of the option to you. So if you need ICD and PCS books, you can pay the deposit of 3K and once completed your course or you don't want the books and already you hands-on practice are there, you can return the book and you can get the refund of 100% of 3,000 rupees. That is one option is there for the refundable deposit or otherwise you can able to use our softwares. We will be sharing you a lot of softwares to you so that will be able to, you can able to work on that. Okay.
Okay, sir.
Okay, fine. So other than that, any doubts or any questions are there? Other than that, any doubts or any questions you people need to be discussed with my end? Or otherwise we'll start the classes. We'll start. No issues. Okay, fine.
Yes, sir.
Okay, just a second. Almost everyone joined. Okay, fine. Okay. Everyone can able to see my notepad, right?
Yes,
Everyone
sir.
can able to
Yes,
see my
sir.
notepad.
Yes.
Okay, fine. So today we are going to be discuss about what are all the materials we are going to be used and what are all the purpose and what is the thing we are going to be learn in that one. So first of all, in the medical coding, what are all the books we are going to be used that you should know. One is ICD 10 cm and another thing is CPT. Okay. So first ICD 10 CM book, CPT book, HIPIX book, PCS book. These 4 things we are using in the revenue cycle management to convert the diagnosis into alphanumeric codes. So these are all the 4 books we are using. What is the purpose we are using ICD 10 CM? Anyone? What is the purpose we are using ICD 10 CM?
Diagnosis codes.
To find the diagnosis codes. To find the diagnosis codes, we are using ICD 10 CM book. Current procedural terminology, CPT. So this kind of codes, it is an alphanumeric code. It is completely numeric code to find the outpatient procedures codes. To find the outpatient procedure codes, it's completely numeric. Numeric 5 characters. This is minimum 3 to 7 characters. HIPIX. What is the use of HIPIX? Anyone? What is the use of HIPIX? HCPCS. Any idea? When we will use HIPIC codes?
Drug charges.
Equipment.
To
ఇప్పుడు when I given in supplementary.
what is the purpose of HIPIX codes? To identify the
Medications.
medical
Drug
supplies.
codes.
Yes. To identify the medical supplies. What is supplies? What is medical supplies? What is medical supplies?
Injections, vaccines.
Vaccines, materials, equipments, this kind of the thing comes under in this category. Next thing is procedural coding system. This is called when any procedure performed in inpatient. When any procedure performed in inpatient, we need to be code it like inpatient procedure code. It is same alphanumeric codes. It's only 7 characters. There is no 3 to or directly it's having 7 characters. One by one during the session, and we will be discussing that. So now you people have an idea what are all the code sets, where they are using, and how it was used by that. So ICD 10 CM book to find to diagnosis code, CPT to find the outpatient service codes, HIPIX codes, medical services and supplies, PCS to find the inpatient surgery codes. Inpatient surgery codes. So this is the thing we need to be find out. So today I'm going to be discuss about like to find the code books. To find the code books. How to find what are all the codes we are going to be code and what are all the things we need to do, that and all we are going to be discussed. Okay. You people are going to be define that what are all the code sets we are going to be use in this scenario. Okay. So I hope most of the people are attended last 2 days session. So you people are aware of this means you can able to say the answer, or otherwise sir last 2 days session I missed means just you can observe the 2 day session, you can able to check with that YouTube session, and I share the details as well. So just you can check there and just listen the classes right now. Okay. Now the patient came to the hospital for finger laceration. The laceration repair was done in ED and patient discharged to home. First of all, whether it is inpatient visit or outpatient visit.
Outpatient visit.
Outpatient.
Outpatient.
This is OP visit.
Outpatient.
Okay. For finger laceration, which one I need to do? I mean, which code set I need to do? And for laceration
ICD
repair, how to report?
CD, ICD form.
ICD
For
10 cm
finger
for
laceration, what is the code?
laceration.
Okay, so for
PPT.
finger laceration, I need to use ICD 10
Oh.
cm codes. And for laceration repair,
CPT code.
PPT.
CPT code. That is clear? That is clear? Okay.
Lead code without lead. So,
What ma?
అది లాస్మినేషన్ రిపేర్ కోర్స్ ఎలా రీచ్ చేయాలో చూపిస్తాను.
I don't want to go for a code leading ma. I'm saying first of all to find what is the visit type this is, which kind of code sets we need to use. We need to know how to code the laceration repair, how to code that CABG procedure, everything during the classes we can discuss. Okay, before that we need to know a lot of this. What is the section this is, what is the medical surgical section, our body system, our section, our root operations, a lot of things is there. Now we don't want to go with that. First we need to know about which code set we need to use, which kind of scenarios. Later we can go with that to find the how to code the scenarios. Okay. So second question. Admitted to the hospital for finger laceration and laceration repair done in ED and move to inpatient services for his hypertension.
After 3 days, patient discharged to home.
Okay, slowly you can read. First, you should have a patience to read the scenario. Okay. So if anyone felt like I'm giving bigger scenario, sir, I'm not able to understand the terms. You are saying something else which is unrelated to me. Anyone is there, please let me know. I can able to try to minimize. Minimize means I can able to shorten my scenarios and I can able to go with that. But it won't be useful. I would like to go with that like a bigger scenarios and I want to make it you understand from the day one itself. Because day one I said that Ipdrg is a complexity is there. So if I'm going to take like simple scenarios, hypertension like this and of now, it's like an advertisement. I don't want to go. You should know the real time complexity of the inpatient coding. That's what I'm taking like this. Okay, it's clear. Anyone felt like difficulties to read the scenarios which I mentioned here?
No.
Anyone?
sir.
No, right? Okay,
No.
fine. So okay, so let me know what is the type this is. What is the visit type this is?
Inpatient.
Inpatient. Right. Sorry, team. I got another Only come call. Okay, so now it is an inpatient visit or outpatient visit?
Inpatient.
Super, it is inpatient. Inpatient visit. Okay, so here how many diagnoses are there?
Two.
Hypertension.
Hypertension and
Hypertension. Finger
finger
laceration.
laceration.
Laceration
So it's look like easy, yeah? It's look like easy. Okay, I will come up with a twist. No issues. Okay, now what is the code set for finger laceration?
ICD.
Okay, what is the code set I need to use? What is the thing I need to use for that?
12011 simple laceration
No,
repair.
I don't want that. If you know that, no issues. Some people don't know that. We can able to go with that like basic things. Okay. Okay. ICD 10 cm. For laceration repair, I need to use which code book?
CPT.
CPT.
CPT,
Yes, yes.
correct?
Correct.
Correct, CPT.
Correct.
Read it once again and let me know.
PCS.
Sorry, just a second. PCS or CPT?
CPT, bro.
CPT. For others, if you are unable to speak, please mention in the chat box. I
Yes,
can
yes,
able
sir.
to understand that.
For inpatient, we use PCS books, sir.
Okay, for inpatient, we will use PCS book. But the laceration repair was
But
done in
laceration
ED.
report done in ED.
Okay, so what I should do right now?
CPT only.
CPT only.
CPT only. Okay. My simple question, I didn't mention like CPT or PCS. My simple question, already it is inpatient visit. Already it is inpatient visit. So I can able to code CPT.
No, sir.
No, sir.
That is one reason. I can't able to use CPT. That is first reason. Second reason, one of the patient came to the hospital for emergency department for laceration repair. Same scenario. If I coded like laceration repair ED department, if you are saying like CPT code, it is ED department, separate bill. I can able to inform the patient, no, you should be paying the ED bill separately, inpatient bill separately. First you need to pay the ED bill and later only I will do admit like that. Can I say? Second thing, I can able to give you two bills for the patient. It is your ED bill, this is your inpatient bill. Can I give two bills for the same patient? Same day he admitted in the hospital. Same day he admitted came to the ED and came to the admission to the hospital. The same day I can able to generate two bills for the same patient.
No.
It is possible. No, it's not possible. So that ED visit also converted into IP. So you should not think it is a ED the treatment was done, but that ED also inclusive of IP. Inclusive of IP. So overall it is IP visit means which is the code set I need to use?
PCS.
Now you got it.
Yes, yes.
Now you have a clear idea. It is fine. So the meaning is if the procedure was done in the outpatient visit also, once the condition or the patient admitted to the hospital, the whole thing is converted to IP. There is no ED report, there is no OP, there is no nothing outpatient specialty setting is there. That account was converted to OP. So it's no longer being OP, it's always IP only. It's clear, team?
Yes.
Okay, I will give you one more example for your better understanding. I will check how you people are making to do that. Okay. What is PT?
Patient.
Yes, yes.
So now, what is the visit type this is? What is the visit type this is?
Lung cancer.
I will read once again. The patient came to the hospital for outpatient chemotherapy. The patient came to the hospital for outpatient chemotherapy because mostly chemotherapy, they won't give you in inpatient. It is a scheduled one, right? Scheduled procedure. They came in the morning and 3 hour session will be and patient will go for a home. So outpatient chemotherapy, regularly the patient came to the hospital for lung cancer. Chemotherapy also performed. You people knows very well after chemo, it is easy to recover from the chemo. Is it very easy to recover from the chemo?
No.
No, sir. No, sir.
Not possible. So suddenly the patient felt generalized weakness. So the physician saying that, weakness is one of the critical symptom. You people need to be remember. So if anyone said I felt weak, as per the, we are saying just I felt weakness, but as per the medical criteria, weakness is a one of the important condition because we don't know what is the etiology of the weakness. Before cardiac arrest, the patient felt weakness. Before NSTEMI, the patient will get weakness. Before STEMI, the patient will get weakness. Correct? So it is one of the severe case. So the patient admitted to the hospital. Next day, the patient discharged to home after IV fluids treatment. So now, whether it is inpatient account or outpatient account?
Inpatient.
Inpatient.
Inpatient. Just now only you
Inpatient.
people said that scenarios are easy to find out. Now again, I'm getting like confused. I'm making confused. No, yes. Actually, this is the real scenarios of inpatient coding. This is the real scenario. I don't want to make you that what is a code for hypertension, what is a code for lung cancer. I don't want to take you like that. This is the real scenarios of inpatient. Correct? This is the real scenario because the patient came to the hospital for some other reason. He admitted to some other reason. Or otherwise the patient came with a severe condition because fever, I'm going to be admit the patient. Abdominal pain, I'm going to admit the patient. Right? I don't want to admit. Whatever inpatient scenario, it's most probably very difficult scenarios only, I will admit the patient. Okay. So now let me know whether it is inpatient visit or outpatient visit.
Inpatient.
Inpatient, super. It is inpatient visit. So now, how many codes I need
Like
to, I mean, how many
because
conditions are there in the scenario?
that is
Lung
the
cancer and
outpatient.
Lung cancer,
Lung cancer and generalized weakness.
Generalized weakness.
Fine. So the next, what is the procedure performed here?
Chemotherapy.
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 And IV fluid.
Okay, IV fluids is common. Inpatient, we won't code like IV fluids and all. It is common one. Okay, so we won't code that IV fluids medication in inpatient visit. So that's what I didn't code it. In day one itself, I don't want to make you to confuse. Inpatient visit, medications, normal medications, we won't be coded. Particular medications only we will code. Okay, so now for lung cancer, what is the code set I need to use?
CPT.
ICD code.
ICD.
ICD team.
ICD. For weakness? For weakness?
ICD.
ICD team.
Chemotherapy?
Procedure of
Chemotherapy PCS.
PCS or CPT?
Procedure code.
CPT.
PCS.
CPT.
PCS.
CPT or PCS?
It is outpatient.
Procedure cost we can choose.
CT inpatient. No PCS.
Finally, the inpatient.
PCS.
So
PCS.
chemotherapy PCS.
Chemotherapy. I need to code PCS or CPT.
PCS.
My opinion PCS.
PCS.
Yeah, okay, you are saying PCS. Okay, just a second.
PCS.
Just a second. Okay, so everyone can able to see the questions in your chat box. Everyone can able to see the questions in the chat box. Okay, so now let me know your answer for what is the code set I need to use for chemotherapy. You can refer before question also, this question also, and refer something else. I need just try your input. Anyway, I'm going to say the answer. Just try your inputs. What is the code set I need to code for chemotherapy? ICD, sorry, CPT or PCS? Okay.
PCS.
PCS, then CPT, then okay, CPT, PCS, CPT, PCS, super. I'm getting a lot of answers. Good, likes, thank you. Okay, fine. So the thing is, it is completely your interest in. So whatever I'm going to take, simply I'm going to take the classes now. I'm also get bored, right? So that's what we'll make some Q&A sessions. Well, compared to the understanding the guidelines, we have guidelines are there. If I'm explaining the guideline, there is no use of the guideline. You should know how to apply the guideline in the scenarios. Okay, so you should know how to apply the guidelines in the scenarios. So that's what I'm taking like this. So chemotherapy can be coded like PCS. It's not a CPT because I told you, right, when the outpatient visit converted into IP, always IP only. Always it is IP only. So that is PCS code only. It is clear, team. Any doubts, any questions you people need to ask, you can ask now itself. I'm going to go next another little bit critical question. Again, I'm going to go little bit critical question. It's fine. Any doubts? Any doubts?
No, sir.
No. Fine. Okay. Can I go next question? Can I
Yes,
go
sir.
next question? Okay, fine.
Abba.
Okay, slowly read the scenario. The patient came to the hospital for cardiac arrest by ambulance. In the ambulance, 2 rounds of CPR was performed. Later, the patient taken back to ICU, placed on endotracheal tube for ventilation, and patient recovered after 4 days. And discharged to home. So now the patient came to the hospital for which condition?
Cardiac arrest.
Cardiac
arrest.
Cardiac
Cardiac
arrest. Okay, so now let me know whether it is an inpatient visit or outpatient visit.
Inpatient.
It is inpatient visit. Super. Okay, so now what is the condition?
Inpatient.
What are all the procedure performed?
Cardiac arrest condition.
Okay, so an endotracheal tube I need to code, and ventilation I need to code.
PCS.
Okay, so cardiac arrest I need to be coded like ICD code, ICD code, and that endotracheal tube
I said
PCS.
Intracranial tube is a procedure.
PCS.
PCS.
CPC.
Ventilation.
PCS.
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 Okay.
PCS.
So by the ambulance, they perform CPR procedure. CPR is a procedure, right? CPR is a procedure.
Yes.
Yes, sir.
Can I quote CPR procedure in this visit?
Sorry, bro.
Can I code CPR procedure in this visit?
No.
Already coded in the chat.
Yes,
Yes.
yes, we can code.
You need to code.
Yes.
No idea, sir.
Yes.
God.
Just mention in chat box how many people responded yes, how many people responded no. I can understand that. Just mention whether.
Chart is another chart, right?
Yes, you can mention yes, no. I can understand whether what you are saying that. Yes means we can code. No means no, we don't want to code. Okay. Yes, no, yes, no. Okay, so whoever said yes, let me know why I need to code CPR. Whether it is CPT or PCS.
PCS.
Okay, yes with the PCS. Okay, yes with PCS.
Ambulance lo CPR ichcharu.
Okay, yes, we can code CPR. Okay, fine. Thank you. Okay, fine. I will reveal the answer. Okay, I will give you one explanation to understand. I will explain. No hurry and all everything. I will explain. Okay, fine. One of the private hospital is there or government hospital is there. Could you please mute yourself, mom? I'm muting yourself, but I'm getting again unmute. Okay, fine. Thank you. Okay, so I will give you the scenario. Just imagine that one of the patient was affected with cardiac arrest. The persons are calling that ambulance. It may be private ambulance, it may be the hospital ambulance, or it may be some other thing will be. We don't know. It is going to be the private hospital. So most of the time, the ambulance and the hospital, it won't be related. Correct? Ambulance and hospital. If it is a private ambulance, it's not be related to the hospital. If I coded CPR, who will get money? If I coded CPR in that account, who will get that CPR procedure amount? Hospital, ambulance.
Hospital.
Who did the procedure actually?
Ambulance.
Private.
Ambulance.
So we have a separate coding is there, ambulatory service coding. Those people will code CPR. So the meaning is whenever the procedure performed in ambulance should not be reported in inpatient visit. Understand? Now you got it?
Yes, sir.
So the
Got it.
procedure done in ambulance no need to be reported, but the documentation will be presented because you've seen that if the emergency department that ambulance doctor also come along with the ED. He will be explained. I did two rounds of CPR. I did that cardioversion. I placed like a PIC line. I given this kind of medications. He given like that. So the physician also will write like that. Ambulatory physician was given this kind of medicines, this kind of procedures he performed like that. He will document, but we should not report the procedures because ambulatory coding having a separate coding is there. They will we have a separate code set is there. The separate guidelines are there. They will follow. They will code. They will get money. If I coded CPR procedure, PIC line procedure, whatever it is, whatever happened in the ambulance, that amount will go for a hospital. Hospital will give you separately to the ambulance persons. If it is private, it's possible. No, it's not possible. So ethical way. So the thing is, always we should not go for a guidelines. Always we should not follow the guidelines. It is different. Coding, even though we are learning the guidelines, sometimes the same guidelines will oppose another guideline. Same guidelines oppose another guideline. So we should not always depends upon the guidelines. Just critical analysis, critical thinking we should improve. If I taken the ambulance, the treatment was done. I paid by the hospital now. That amount won't go for an ambulance. So I don't want to code the CPR procedure. That is the concept. Guideline is there. Ambulance procedure cannot be coded in inpatient visit. That is a guideline. But you should know why the guidelines are there. Correct? You should know why the guidelines are there. That is the reason. Now you got it.
Yes, sir.
Now you got it. Okay. I think I'm giving just 3 lines, 2 lines. Just I started with 1 line, 2 line, 3 lines. Can I give little bit bigger scenario like 4 to 5 lines?
Yes.
Or otherwise, sir, it is itself I'm getting more confused. Still, why you are going with more thing? It is fine.
Fine, sir. No issue.
Okay, so I will be going with that some little bit tricky and easy scenario. Just you should understand the terms and try to find out that what are all the things going to be do that. Okay. These are all real chart descriptions, team. Whatever given I'm example, it's all are real time examples. Real time examples means you people are going to be working in the inpatient visit now. Compulsory the chart will be like that only. All the patients come to the ambulance, all the patient reach to the ED, and after ED only it is possible to admit. Directly no other patients came to the hospital for admission. Correct? Any other patient will, I have a fever, please admit me, like that the patient will come. No, first you need to go to the ED.
No,
He
sir.
will checking the temperature. If it is 100, they will give you some medication. If it is 104, they will check with that blood cultures, urine cultures, and after that only they will moving into the inpatient. So ED visit will be mandatory. So if the patient came to the hospital for a fracture, at the time only directly they will be admitted to the hospital. So there is a different set of thing is there. So we need to be understand the conditions. It's clear, team? Okay, can I go with that another question?
Yes,
Fine.
yes, sir.
Next.
Yes.
Arthroplasty. Anyone know what is arthroplasty? What is arthroplasty?
Knee surgery, I think.
Knee replacement. Knee replacement. So aged people they will go for an under knee replacement surgery. That is called arthroplasty. Okay. Okay. So what is the visit type this is?
Inpatient.
Inpatient type.
Inpatient.
It is inpatient. Okay, fine. Inpatient visit. So what are all the conditions are there? What is the reason they will do arthroplasty? Which condition they will do arthroplasty? For osteoarthritis, joint pain or something else, they will do. Okay, so arthroplasty. So we can code like arthritis. Arthritis. And any other conditions are there?
Anemia.
Acute blood
Anemia. Acute
Anemia.
blood
Acute
loss.
blood loss. Anemia.
Anemia.
Okay. What are all the procedures performed?
Arthroplasty.
Osteoplasty and blood transfusion.
Arthroplasty procedure performed and blood transfusion performed. Okay.
Blood
Blood transfusion.
Blood transfusion performed. So now arthritis is there and anemia is there and arthroplasty is there. Blood transfusion is there. So what is the code set I need to use for arthritis condition? I need to use
ICD-10.
anemia. Same.
ICD-10.
For arthroplasty procedure,
PCS.
PCS.
PCS. Blood transfusion.
PCS.
Got it. So everything is clear. So now you people have an idea about that, how it should be coded, why I'm coding PCS, when I need to code CPT, how to identify whether it is inpatient account or outpatient account, how the outpatient account converted to inpatient account. Now you people have an idea, right? I don't want to say like you people understand everything. Just you people have an idea right now. Got it?
Yes,
got it.
You people have an idea. Because why I'm saying this kind of fundamental and all everything now, most of the people sometimes they will go for a companies, they know the guidelines, but they don't know the chart exposure properly. Chart exposure is there also, they can do some charts, but they don't know how to find out this is my account or not, my account or not, this is inpatient account or not, this is observation visit or not, this is the other rehab facility account or not, this is a hospice account or not. They don't know how to identify the account. That is a major issue. It's not a simple issue. That is major issue. Major issue means everyone will think like you don't know anything else. You don't know, even though you knows everything, ICD guidelines, PCS guidelines, 3M navigations, everything you know also. If you don't know the basic kind, what is 2 midnight rule, what is how to find out a OP account to inpatient account, how to find out OP to observation account, and when I need to code CPT code, when I need to code PCS codes. So these kind of guidelines are more important in the basics level. In the basic level. So that's what I didn't started any guidelines classes to you to okay, we'll go for like, and that's what our duration is high. You can check anywhere in the industry, market industry, everyone will complete within 45 days, max to max 2 months, they will completed their course and they will be moving into another batch. But we are increasing the timing duration. We are also did before, but later we completely changed into 3 months, and we are informing our old candidates to join the new batch to getting into the new materials and new things as well. So that is the thing. Our motto is to get into know from the scratch. Even though you are saying a experienced candidate, you know ICD, whatever it is, my motto is to know from the scratch. Now it will be understandable. It will be understandable because everyone are not getting 100% quality. Even though you are a 3 years experience or 4 years experience, all the time you people are getting 100% quality. If you are an experienced candidate, it is
No.
possible.
no,
Not
sir.
at all possible.
No, sir.
In the same office, only 60% quality coders also is there. If they wants to learn Ipdrg, I need to go for a scratch. So that's what I said, that even though before we have a different batch for freshers and different batch for experience, like that we separated. But later we know freshers are doing well compared to experienced candidates. It's reality. If people agreed or not, compared to we have a data, freshers are doing all the assessments. I know experienced peoples are having like a work pressure and they people came late and only Saturday and Sunday you have, but the dedication, you are also paying the fee and they are also paying the fee. They people are utilizing more. They people spend more time with the assessments. They people are doing very well in the interviews. Very well in the interviews. Last time, yesterday only we placed around like 13 candidates in one of the company, and they said that good feedback. Yes, they did well. They are having aware of that. These kind of areas are they focused. These kind of areas we didn't expect that they are saying the answers, except some people. So this kind of feedback when we get now, it's look like okay, fine. So okay, we are doing good. So that is the thing I'm expecting. I hope you people are attended a lot of demo with that some other institutes demos also. I hope you people are attended compulsory, because you people are in a lot of Telegram groups and WhatsApp channels and everything. You people can compare fees wise, you can compare, and material wise you can compare, and that training wise you can compare and see. That's what before, where there is a one-time payment is there. Now we changed it into that 3 months. If you are felt like it is not suitable for me, you don't want to continue in the next month, you won't last that much. You won't last that much, right? Only 5K will be there. So that's what we segregated in the fee structure also, because of our confident level. We know we are giving best level of training, and we can able to place the candidates in whatever the companies are hiring. So we have a confidence. So that's what we are making the charges like this. So you can able to join. This is the last demo for us. And from Monday onwards, the classes will be started, and whoever paid the fee and all everything, you will get in a complete access, because that access will be removed after 7 days automatically. If you pay, the taxes will be stay remaining there, and I will be uploading the classes recordings also there, you can able to see. So before going to end of the session, you have any concern or anything you need to talk, or anything you can able to discuss, means you can discuss, and I will be waiting in the session. There is no issues. And registrations are going to be started from tomorrow and day after tomorrow, and I will be I already share the details in the payment details in the group. please pay to that numbers only, because a lot of scams are going in the outside. So you should get our company private limited account. So you will get a bill copy as well after paying that. Okay, if you want to pay by the credit card or debit card also, we have the separate links are there. You can pay through that our, that is also registered private limited account payment link. Use that links only. Don't want to use another links or something else. And better to pay through GPay in the same number, whatever the number I posted, that is the only number is there we have. Other than that, we don't have any numbers. We don't have any payout, pay details and all. Everything will be comes under into the accountable category. So there is no risk on that. Don't want to pay any other people or don't want to pay any other persons to share. No need. Only one number is there, one payment link is there. That is the thing is enough. If you want to pay directly, I will be available in institute. You can pay, come and meet me and directly to pay all the and continue the sessions as well. It is clear.
Excuse me.
Yes, please.
Excuse me.
Yes.
I want to know that CCS batch when will start next?
If you are a fresher or experienced, ma?
Experienced.
Experienced batch people are going to be started from Monday.
Monday means this
Monday. Demo will be scheduled on Monday, and Monday to we have continuous classes.
Okay. So
Okay,
how?
so there is no Pongal
is-
holidays for CCS candidates. There is a continuous classes will be.
So Monday will be the demo class.
Yes, Monday will be the demo classes in the same link. So the demo classes always in the same link only. You can join in that link.
Okay.
We will be sharing you the details.
Okay, I'm from Abu Dhabi. So Indian time 8:30.
Yes, Indian time 8:30 IST. All the demos will be scheduled at 8:30 PM in the same link. Okay.
So how can I transfer the payment like that?
I will be sharing. You joined in the group.
Okay. Yeah. One group I joined.
Yeah, in the only one group. If you are in that another groups also, you can exit from the groups. This is the only official group, and in this group you can able to see our official verification badge as well. So in that group is enough, and in the channel is enough. So I shared once again for the group link. So that is you can able to join it.
Group link is your this one. Okay.
Yeah, this one I shared.
Okay. Thank you.
Okay.
Sir,
So
I
thank
have
you.
a doubt.
Yes, please.
Sir, actually, I'm a life science graduate
Okay,
and
ma.
I have a career break because
That's
I
what.
got
If you
married.
need any other personal consultations, ma, I share my number. This is my number, and you can connect with me, or otherwise you can text me if I didn't pick up the call, and I will give you connected with you and give you the better guidance to you.
Okay.
Okay, so 10 a.m. to 5 p.m. you can call that number, and I will be assisting you which one I want to do and how I can able to make it that. Okay. Okay. So thank you, Tim. Thank you so much. Thank you for joining us. And application access, I seen your numbers and I can able to give you the application access by EOD itself. Or otherwise, if you need, you can send me this number. Also, I can able to follow up with you. Okay.
Hello?
Yes, please. Yes, please. Yes, ma'am.
Weekends classes will be there. Hello?
Weekend classes are going to be started after Sankranti, ma'am.
Okay. Weekdays?
Weekdays, it already started. From Monday, it's going to be started.
Okay, sir. Classes will be taken by you only, right?
Classes will be taken by?
You only, right?
Most probably I will be there, and in this batch completely I will be there.
Okay, sir.
Okay, what happened?
No, it's in place.
Okay, fine. Okay, so fine. So we have the well-trained trainers also is there, so there is no issues. If I'm not there also, other people will be continuing the classes. I will be taking the classes also. Okay, I will be taking like your live chat sessions and interview preparations and all everything I will be handling. Okay, for the preparations.
Sir, already మీకు నేను పర్సనల్ గా మెసేజ్ చేశాను సార్. హలో.
Yes, ma. Yes, 8:30 PM IST. Yes.
సార్ ఆల్రెడీ నేను మీకు పర్సనల్ గా మెసేజ్ చేశాను.
I will check and I will reply.
సార్ అంటే మార్నింగ్ చేశాను సార్. మార్నింగ్ ఎస్ఎంఎస్
10 to 5 I will be there, ma. 10 to 5 PM.
ఓకే సార్. ఆల్రెడీ సెండ్ సార్.
Okay, fine.
టుడే మార్నింగ్.
Okay, thank you. So how did you feel? Okay, fine. So how did you feel the demo? So did you learn something else new?
Yes, sir.
Yes, sir. For
Yes,
me,
sir.
that's also new, sir.
Yes, sir.
Okay, so thank you. So the thing is, my motto is to know something else new apart from other institutes. That is my motto. So that's what we are taking this kind of classes to you to understand the basic things. And later regular ICD classes will be there. That is also full of example. We are not reading the guidelines. We are going to be give you lot of examples to apply the guidelines. So that is a specialty is ours. Okay. So thank you, team. Thank you so much. Thank you for
Bro,
joining with us. Yes, ma.
chatல
Yes,
நோட்
ma.
chatல பேஸ்ட் பண்றீங்களா ப்ரோ?
நோட்ஸா chatல பேஸ்ட் பண்ணவா? ஓகே, பேஸ்ட் பண்றேன், எடுத்துக்கோங்க.
Hello, sir.
Yes,
One
please.
more
Sir, I have one doubt.
Yes, ma. Yes, yes.
Will you tell me the page range of one chart in Ipdrg?
You want?
Page range of one chart in Ipdrg.
I'm not understand, ma. Pay?
Live charts page
I want to know
range.
page range. Means
Actually, how many
pages?
pages
Age
chart is
criteria,
coming
wow.
in patient?
Yeah, age criteria, it completely depends upon the companies, ma. Yesterday I discussed with you that companies. Some
No.
companies there is no age
No.
criteria. Some companies having the age
Sir,
criteria.
no.
Okay, so max to
I'm
max
not
I can
asking
able to
about
consider
No
like
age, sir.
35.
Actually,
I'm not
actually,
asking about
he
page
asking
range.
about sir
I want
page
to know
range.
page ranges
Page
of
range in
one chart.
Page counted.
I'm
Live
not,
charts how much pages in front?
I'm not able to, sorry, I didn't hear that. If it is possible to mention in the chat box, I can understand that. I think I'm not able to hear
Yes, sir.
properly.
Live charts page count ఎలా వస్తుంది?
Live charts?
He's
Page
asking
count.
page count of live charts.
Page count of live charts. Okay, sorry. Page count of live chart is not at all depends upon the, we can't able to say that. Simply I will say, one of the psychiatric patient came to the hospital, he stayed 10 days. Maximum the pages will be 100 to 150. But the same, if the patient came to the hospital for critical condition like CABG procedure was performed, the pages will be 300. So we can't able to say this is the pages for this many days. This is the pages for all the inpatient condition. Not like that. We don't have this kind of criteria. Sometimes 1 day stay comes under 60 to 70 pages. 10 days stay comes under only for 50 pages. So we can't able to say. It depends upon the diseases. It depends upon the condition. It depends upon the patient age. It depends upon the patient previous histories. So it will be different. So minimum you can think like that 100 to unlimited. Okay, minimum 100 to maximum unlimited.
Okay, sir.
It's not in our hands. It's all about our projects. Okay, it's clear. Harita, I told you, right? Just you can send me the text message with the number and I can able to provide you the access. No issues. Okay. Okay. So thank you, team. Thank you so much. And
Sir?
yes, just a second. Yes, ma.
Sir, I'm an experienced coder.
Okay.
Move to Ipdrg means outpatient coder, sir. Move to Ipdrg means which training is first completed? CCS or Ipdrg training?
You are already certified,
Non-certified, sir.
Then you can continue with that basic training from that Ipdrg with the CCS, ma. So first we will be completed your Ipdrg training and later last month you people have a CCS training. So within the 4 months you will complete everything, ma.
Okay, sir. Okay, thank you, sir.
Okay, ma. Because CCS contains 33% of the inpatient topics as well. Okay.
Okay, sir.
Okay, ma. Okay, so thank you, team. Thank you so much. Thank you for your patience and you joined and keeping your answers well. And
Sir,
we'll
Jagadesh
continue on
sir.
Monday. Yes,
Hello,
ma.
sir.
Thank you, sir.
Yes,
Thank you
ma.
so much, sir. Sir,
Thank
thank
you.
you so much. I am a fresher, but I can
Mm.
clearly got it.
Got it. Okay, fine.
I hope your classes continue. ఈ ఐపీడిఆర్జీ కోడ్ లో మీరే ఉంటారు కదా సార్?
Yes, I will be there, ma. I will be there. No issues.
I cannot hear sir. I am fresher, but I understand, sir.
Okay.
Thank you so much, sir.
Thank you. Thank you so much. Thank you, team. Thank you so much.
చాలా
We'll meet you
బాగా
on Monday.
Thank you,
I will
sir.
be joining on Monday. Okay. Thank you. Thank you so much. Thank you.
Thank you, bro. Thank you.
Thank you.
Thank you.
Thank you.
Yes, sir.
Thank you.